One of our presentations at this conference this year is a frontline study in patients with chronic lymphocytic leukemia. We evaluated the combination of bendamustine in combination with obinutuzumab. Now, in CLL, there's been a lot of change recently in the field, and frontline management for these patients has been changing. Some patients are suitable for targeted therapy approach, and some patients are suitable for chemoimmunotherapy. And even to this date, there's a lot of back and forth about who's appropriate for which. We took all patients and randomly, there's no randomization. All patients got bendamustine in combination with obinutuzumab. Now, our European colleagues are frequently familiar with obinutuzumab probably being a better antibody in CLL. The German study group had previously published superiority of obinutuzumab over rituximab on top of a chlorambucil backbone. But at least in the United States, bendamustine remains the most commonly used chemotherapy. So can we add a better CD20 antibody to the backbone? Now, this has been studied before. There was a small study from Boston that looked at about 20 patients, and there was a fairly sizable cohort in the German GREEN study looking at bendamustine obinutuzumab. And the German study was interesting and provocative because it showed a very high rate of minimal residual disease negativity, numbers that I think were almost kind of surprising, but not only surprising, but almost is this real type results. And I'm pleased that in our report we show that in fact our minimal residual disease rates using that regimen are highly similar to the German study group. We had overall response rates of about 90%, complete response rates of about 45%, and amongst all evaluable patients tested for minimal residual disease negativity, that number was about 80% negative. And we also had high levels of minimal residual disease negativity in the marrow as well. So this really confirms efforts from the German group. The German study has been presented in abstract form, has not yet been published, and our findings really corroborate theirs. We don't have mature follow-up on this study yet to know the durability of the response, but I think that this is a very active regimen. Notably, we had somewhat less complications with neutropenia and febrile neutropenia, but we did use prophylactic white blood cell growth factors. And similarly, we had a little bit less of an issue with tumor lysis syndrome, and that may have been because we gave obinutuzumab prior to the initiation of bendamustine. So rather than starting both on the same day, we actually offset that. So patients had a chance to, quote, debulk a little bit, and maybe that changed the tumor lysis syndrome. In summary, very active regimen, very pleased with it. This was not a phase 3 or randomized study, so this isn't designed to get approval, but to show that the combination is both safe and effective. And I think it's a very impressive regimen.